Good afternoon, everyone. I am Dr. Annu Bharti, PG2 from the DMCS Darbhanga. My topic of presentation is congenital aniridia. No financial disclosure. A 6-year-old male child came to the IOPD and his mother complained of his decreased visual acuity in both eyes and increased sensitivity to light and difficulty in focusing on objects. Parents reported occasional discomfort when exposed to the light since birth and the abnormal movement of eye noticed at 1 year of the age. Patient had full-term normal delivery with normal weight. Child had completed all doses of vaccination, no previous surgery or systemic illness. His mother and his aunt had also similar presentation and abnormal movement of the eyeball and aniridia. On ocular examination, visual acuity is finger count close to face in both eye and horizontal nystagmus present in the both eye. Eyelid adnexa and conjunctiva were within normal limit. Cornea is clear in the right eye and the clouding with signs of superficial vascularization around the limbus present in the left eye. Absence of the visual iris in the both eye. No pupillary aperture present in the both eye. Clear lens in the right eye and the mild anterior polar cataract present in the left eye and poorly developed angle structure present in the both eye. Fundus where foveal reflexes are not seen and the vessels seen over the fovea. Intraocular pressure were within the normal limit. On systemic examination, developmental milestone and the neurological examination were normal. On investigation, ultrasound abdominal, no abnormality found in the kidney. Chest X-ray and the CBC were within the normal limit. Genetic testing, PAX6 gene testing was advised. Differential diagnosis are the Weger syndrome, Axenfeld-Rieger syndrome, and the albinism. Management includes visual rehabilitation, spectacles with tinted glasses for the photophobia, and the low vision aided provided for the visual therapy. Corneal protection, lubricating eye drops were started to reduce the risk of the keratopathy, and the patient was educated about the need of the regular follow-up to monitor the progression of the aniridia-related keratopathy. Cataract, since there is the early signs of the cataract, patient will be monitored every 6 months to assess for the progression of the cataract. Glaucoma screening will undergo regular IOP measurement along with gonioscopy to monitor the anterior segment angle structure. Genetic counseling were advised as it is autosomal dominant for the risk of the future offspring and the possible systemic implications. Regular renal ultrasounds were advised. Discussion. Aniridia is a rare congenital disorder characterized by the partial or the complete absence of the iris in one or the both eye. It is typically inherited in autosomal dominant manner associated with PAX6 gene mutation on the chromosome 11p13. Other phenotypes are the congenital sporadic, includes Weger syndrome and the autosomal recessive associated with cerebral ataxia and the mental retardation seen in the Gillespie syndrome. Ocular manifestation includes photophobia, nystagmus, decreased vision, amblyopia, strabismus, secondary to the foveal and the optic nerve hypoplasia. Other ocular abnormality includes corneal opacification, cataract and the glaucoma and the foveal hypoplasia. Management of the aniridia, it involves multidisciplinary approach. Iris defect is managed by the colored contact lenses, corneal tattooing and the corneal stromal implants. Corneal protection includes mild keratopathy can be managed with topical free lubricants, and the moderate and the severe keratopathy is treated with autologous serum and the amniotic membrane transplant. Early detection of glaucoma is useful for the prophylactic anti-glaucoma, but prophylactic goniotomy is quite effective in the preventing or delaying the onset of the glaucoma. Cataract monitoring is the essential and the genetic counseling were advised. Cataract management is essential. Specialized intraocular lenses that incorporates an artificial iris diaphragm can be used to correct aniridia at the time of the surgery. Conclusion. Aniridia is a rare congenital disorder with significant implication for the vision and the overall health. Though there is currently no cure for the condition, early diagnosis and the regular follow-up and a provocative management approach are the key to minimizing complication and thus can significantly improve the quality of the life. This case highlights the critical role of the ophthalmologist, geneticists, and the pediatrician in the care of the aniridia patient, ensuring comprehensive management of both ocular and the systemic manifestation. These are my references. Thank you.